So as you can see on your screen, globally we have 32,498,000 positive confirmed cases, and over 989,000 people have lost their lives to COVID-19 related illnesses, and the recovery rate there, over 23,991 people have actually recovered from COVID-19. This is of course the global picture that we're painting. All right, so let's just zoom into some countries as it is now. As you can see, the United Kingdom has over 409,000 confirmed cases, with 41,862 deaths that have been reported in the United Kingdom. Germany, 278,070 confirmed cases of COVID-19, 9,428 deaths having been reported there. We go to France now. France has just over 31,270 deaths confirmed, 458,132 confirmed cases of COVID-19. All right, so let's move on to Italy now. As you can see, Italy is sitting at 302,537 confirmed cases of COVID-19, 35,758 deaths have been confirmed there in Italy. All right, so the final one there being Spain at 693,556 confirmed COVID-19 cases, with deaths sitting at over 31,034 in Spain. All right, so let's just bring it back here home in South Africa, where the number of COVID-19 related deaths has risen by 77. This, of course, takes the total to 16,283. The country has also registered 1,861 new positive coronavirus cases. And of course, this takes the total to more than 667,000 confirmed cases here in South Africa. 58 of the new deaths were reported in Gauteng, 8 in KwaZulu-Natal, 7 in the Eastern Cape, and 4 in the Western Cape. Recoveries now stands at 595,916, which of course translates to a rate of 89.3%. All right, so meanwhile, the World Health Organization says South Africa has recorded an increase of 6% in cases in the past 7 days. This despite there being a 2% decrease in the number of COVID-19 infections on the African continent. This as the country records a further 1,861 new cases, as we said, bringing the cumulative number of infections to 667,049. Meanwhile, 77 more COVID deaths were registered, bringing the death toll to 16,283. Let's just take the discussion further now. We're joined via Zoom by Dr Angelique Coetzee. She's the chairperson of the South African Medical Association. Doc, a very good afternoon to you. Thank you so much for joining us here on the SABC News channel.
Thank you, and thank you for inviting me. And a good afternoon to all the viewers out there.
We thank you so much for your time. So the WHO is saying that South Africa has recorded an increase of 6% cases, this being in the last 7 days. What's happening here? Are we likely to see a second wave of COVID-19 as more and more people now sort of disregard these COVID-19 guidelines?
Yeah, we have said from SAMA's side that we are expecting a second wave. So far, if we look at the trends in other countries, the second wave will most probably hit us around about December, as that is our big holiday time and festival season. And as you correctly said and pointed out, that the people doesn't adhere anymore to the 4 very important guidelines that's out there: the masks, the 1.5 meters, the hand washing, and the natural airflow that is so important. We know that since lockdown started, that certain communities and in certain places, it was extremely difficult to adhere to these 4 measurements or 4 guidelines that needs to be followed, and people didn't follow them. But that is not going to make a difference going now forward, in the fact that because I did not adhere and most probably have a bit of herd immunity, as some of the stats is showing us, it's not a guarantee that we will not get a second wave. We're also aware that the immune system doesn't last against the COVID-19 virus. So going forward, it's going to become more difficult, and people need to understand this, because the COVID-19 test, the PCR test, where we test you in the nose and the throat, that test can stay positive for up to anything till 80 days after you had COVID. So it's going to become very, very difficult moving forward to say who's actively infected, who's a carrier, and who's only shedding dead virus particles. So very difficult going forward, but we will have to look at the hospital admissions and again the death rates. For now, the death rate stats is a bit of a problem and a worrying to SAMA, because we are seeing that patients dying from COVID-19 on the death certificate will stand natural causes, and which again make it extremely difficult to say how many cases currently of people dying is really COVID related. And that also gives a false reassurance to the patients and the public out there that, 70 patients died today from COVID-19, it can't be that bad. 2,000 on a daily basis is contracting COVID-19. Again, difficult to trust the stats.
But then what's the best way of doing it? As you say, it's a bit difficult to get the correct number of deaths and I suppose the correct number of positive cases as well. Do we continue running more tests so to get that accurate picture of how we're looking at South Africa? How should it be done going forward?
You can run more tests, but again, as we have said, it's difficult to say where are you, because the test cannot distinguish between a positive active virus and someone who already had the virus a month ago but only shedding dead particles. The test cannot distinguish between the two. So the most important thing, I think, going forward is to get community involvement, to get your communities to understand that, the threat is still there and it's real. And so that's the first thing, it's communication. The second thing is to try to protect the vulnerable people. With that, it is healthcare workers and the old people above a certain age group, in the old age homes, and people who have underlying comorbidities like hypertension, sugar, and all of those things. That is the most important people going forward, to start to protect them. And then if we can pick up hotspots where there's an increased number of infections, again, you'll have to rely here on your hospital admissions to sort of lock down that particular environment or community to get the virus under control. And because people think that the vaccine is going to save us. The vaccine will not be there for each and every person out there. They will not be able to bring 50 million vaccines into the country once the vaccine
Doc,
is
I'm afraid
available.
I've got to come in there due to time constraints, because we've seen countries in Europe reimposing strict COVID-19 guidelines. The borders will be open in South Africa this coming Thursday. The president, of course, did say that a number of countries that are deemed high risks, there will be a decision made upon that. Nothing has been said as it is now. Should we be worried? Should we start, panicking?
We should not panic, but we should be worried and we should stay on high alert. And here, one of the previous interviews that you had with the Inspector General, it is clear that they understand the problems that we are facing. And again, we still find people going to the shopping centers as if it is a family outing, going to Casualty for the dad's got a sore throat and then the whole family, goes with. they need to understand that there should not be family outings to any place which is in a closed environment and there's other people around them. That is where the virus where the virus pick up his next host. Because the virus need another warm body to be able to exist. So nothing better than everyone sitting in a waiting room for one person and then get it in that waiting room because it's there and it's extremely difficult. And we understand that if someone is in hospital admitted, that you cannot get visitors. Even there we need to come up with some plans because on the other hand, it's extremely traumatic for a patient to die lonely in a hospital setup without family being able to share the last few hours or so with the patient. So there's a lot of work that now needs to be done. So groundwork needs to be done. We are aware that most probably there will be a second wave, looking at the previous, again, stats that we have seen from other countries.
Okay.
So now is the time where we need to prepare and make sure that we are absolutely in charge of a next pandemic or a next wave that will come. And not sitting back and say, oh, lockdown 1, nothing is going to happen.
Yeah.
So extremely important to have that.
All right.
If that makes sense to you.
It does. I'm afraid we have to leave it at this, but thank you so much for coming through.
Thank you so much. And again, thank you to all the healthcare workers out there.
Yeah. All right. Dr. Angelique Coetzee, she's the chairperson of the South African Medical Association.